Hey everyone, good Wednesday evening. I'm Scotty Powell here with the Carolinas Weather Group. Welcome to another episode of our little weekly show that we like to do here on Wednesday evenings around 8 o'clock. And tonight, a very interesting topic as we're going to be talking about weather and your health and how you may ache and pain and all that kind of stuff with the different temperatures and different types of precipitation and stuff like that. We have kind of a slim group tonight as Ricky is preparing for a major test tomorrow. And I think Matt is running late because he had a test tonight as well. And Daniel is off on assignment to God knows where. I have no idea where he's at. So he's not with us tonight. But you have Joey and myself, and we will introduce our guest here in a little bit. I guess talking about weather-wise, it's been kind of a cloudy, cool period of time for us. We've had on and off rain throughout the weekend, and then the past couple of days it's just been clouds, more clouds. Temperatures have been in the low 70s here in the foothills and mountains of North Carolina, and not a lot of rain, especially, or at least here in Morganton, we haven't had a lot of rain. But I know that they've picked up some rain over the mountain or across the mountain where Chris is at. I know he had some flood warnings and stuff like that earlier this week that he will talk about when we toss it to him. But again, here in the foothills-wise, we're doing pretty good weather-wise, just kind of a cloud storm, nothing more than that. And I'm here in the office tonight trying to get ready for our Burke Weather Barbecue that looks like it's going to turn into Floodfest 2014 as we have a very active weekend weather-wise coming up for us here in North Carolina. So I'm going to toss it to Joey, and he can talk about his area, and then we'll go from there.
Scotty, I'm 20 miles from you. We had the same weather.
I know, but I was trying to make it where the other viewers didn't know that.
But anyway, yeah, so what Scotty said is applied for down here also. Like Scotty said, we got our barbecue coming up Saturday, so that's going to be interesting. Any of our viewers that are watching that want to come join, be sure you do. As for next week's show, also we have the Hurricane Hugo special. We might want to make sure we mention that since that seems to be a really big deal for everybody. They seem to be pretty excited with that. So what I'll do is I'll introduce first. I'll introduce our guest. I'll introduce Chris first, since some of you already pretty much know him. He's been on our show a few times now. Chris, tell us who you are, where you work out of, and a little bit about you there.
All right, I'm Chris Michaels, a weekend meteorologist with WCYB in the Tri-Cities, so Tennessee, Virginia, a little bit of North Carolina, and a little bit of Kentucky. As far as our weather goes, still been a little bit warmer than I would like it for this time of year. High temperatures during the day in the Tri-Cities at least have been low to mid-80s. We had one really weird day on Sunday where it was just, if I told you that it was going to be highs from 64 to 84, you probably would have laughed at me. But in Wise, Virginia, at one point, temperature was 64 and there was dense fog. And in Bristol, Virginia, which I believe that's about an hour and a half difference, it was 84 degrees and sunshine. Just a really wacky weather setup. It was pretty cool to see a little bit of a wedge. We had our Skycam in Boone, North Carolina, and then our Skycams in Kingsport, Tennessee, and Bristol, Tennessee. And I posted onto Facebook and Twitter the two pictures, one in Kingsport, one in Boone, and the one was sunshine and one was clouds. It was just, as frustrating as it may be to forecast for as a weather geek, that's the kind of days you live for. Nobody's getting hurt by any severe storms, but it's a forecasting challenge nonetheless. So, hoping for we got tomorrow. The changing weather pattern is starting up. We got a cold front coming through, some storms coming in, and after that, weather looking pretty cool, pretty autumn-like, which I can definitely get used to.
I'm with you there. And then speaking of that wedge, kind of leading into what our topic is for the night, that sunshine and versus that cold, cool, cloudy stuff, a big difference in how a person feels. As us weather people know, a big thing about what we do is we have to forecast impact-based things. And a lot of times that leans towards severe weather and how it's going to affect your day, or maybe how the rain is going to affect your outside picnic. But for some people, that weather definitely affects how they feel inside. Their, the aches, the pains, all the way to headaches, even mental issues that we're going to touch on a little bit today also. And our special guest that we're going to bring on today to talk about that is a good friend of mine. We've been friends for, way longer than we should count. But this is my good friend Josh Pannell, who is right now an intern doctor, and I'm going to let him introduce himself, tell you about where he's going to school, what he's studying, a little bit about what he does. Josh?
All right, guys. I'm an intern, like Joey said, of chiropractic. I'm down here in Spartanburg at Sherman College. So a lot of people think they know what chiropractors do. Some people claim they don't know at all. Everybody thinks low back pain, that's what we're for, and we are for that. But a big thing of what we're doing is trying to reduce interference between the nervous system and the body. And I'll show you real quick. So you're going to have a spine, and each of these vertebrae, down through the vertebra come nerves. You have your spinal cord through the center, and the nerve roots will come out. And I don't know if you can see coming through there. But all this is signals coming through the brain. And basically, everybody knows we crack your back, right? So we're popping those vertebrae, moving those vertebrae to allow for less interference to be present at the nerve, which will in turn increase the potential of your immune system, the function of your bodily organs, just about anything. You can see huge results in all kinds of issues, allergies to diabetics. There's a lot of amazing stories out there that are anecdotal, but still, there's a lot of things that chiropractic can do. It's that misalignment that we're wanting to rid the body of, which can cause pain, and that's why a lot of people come to us. But in the end, what we're doing is allowing that nerve to communicate the way it should. This health and weather is a very tricky issue. I'm finding out that there's a whole biometeorological area that's designated to it that's still kind of small. So this is kind of new to me, and I talked to a few docs and did a lot of research, and I'm going to try to do my best here tonight. So we'll see what I can do, and anything I can't answer or don't have a good answer for, I'll write it down and I'll get it back to you guys so you can broadcast it another night. So we'll see what I can do for you.
That's awesome. And another thing that I learned since you've been going to chiropractic school and in the medical field, I used to go see a chiropractor a lot. I have a lot of back issues, but I didn't realize how much of the entire realm of the medical field that you actually have to learn. A lot of people always think that a chiropractor is the guy who cracks your back and does that thing. He doesn't know, internal medicine. He doesn't know, a lot of the other stuff. But I've learned from seeing the things that you've learned and the things that you study that it goes way beyond cracking your back into. I mean, you literally you are a doctor. A lot of people call chiropractors not a real doctor, but you really are, and you really have learned a lot of that other stuff. Touch a little bit on some of the stuff that you guys are taught in that field that carries over into the regular medical profession.
Oh man, well, I forgot most of it by now. That's how much we learn. It really is a field that a lot of us go into thinking, oh, this ain't going to be too bad, and a lot of our families think that too, and it is pretty tough. We spend at least a year on just neuroscience alone. We do 9 months of anatomy. We have X-ray from. I mean, once you start taking X-rays, you're about a year in, and you're working with X-ray physics, positioning, diagnostics, so like hard tissue, soft tissue. So being able to recognize like something like tuberculosis, diverticulitis, something in the gut. If it can appear on an X-ray, we have to know about it because we're taking X-rays. So there's a lot of involvement that we get into, and now I'm kind of on the downward slope. It doesn't feel like it's a downward slope, but I'm over halfway, and we're doing a lot of diagnosing now and really dialing in how you know about each separate condition in the visceral aspect at this moment. But we focus mostly on musculoskeletal. But like I said, you're going to have to know all of it. And like later on, we may touch base. Everybody comes in with low back pain, but a major thing that can happen that presents with low back pain is prostate cancer. And I may be bringing it up here a little bit later with some weather-related topics. And that's something you're going to have to know and be able to heed those warning signs that the patient tells you about and be able to recognize it on X-ray, or at least the possibility of it, to get them to where they need to go. We do work with a lot of other fields because people will come to us with a primary concern of pain, and it may be pain that we can work with, or it may be something we need to send them to an oncologist, or we need to send them to get an MRI done, or even just their general practitioner to get some antibiotics. So it's a pretty wide scope, and there's a lot of different chiropractors out there who cover a lot of different areas. So you can have just a sports side of it. You can have somebody who just wants to take care of you just to be healthy, or you can have somebody who's going to focus on conditions. So there's a lot of involvement that most people and even a lot of chiropractors don't realize until they're really deep into it.
Yeah, so that was something I noticed after, from learning things that I see that you've studied over the past few years. Kind of the way we're going to run this program tonight, I'm going to kind of just touch on a topic and kind of let you just kind of go into explaining it. Chris, kind of back us up, using your meteorological background. We'll just kind of just open up a few different topics of where weather affects people's health, and we'll just kind of work from there and just sort of just talk it out. We'll have a lot of direct questions per se, but we'll just sort of just have a talk. We'll kind of call it in the ring tonight. That's kind of how we'll do this. But one of the first things, I took a few notes on some of the most common things that you hear people talk about, and some that are least common, and we'll touch on those as we go. Obviously, the most common is I know it's going to rain because my knee hurts or something like that, and we're going to get into that. But I want to touch first on one that kind of surprised me, and it's run in my family, but high blood pressure runs in my family, and I noticed that a lot of people, think that your blood pressure can be affected by the weather. Josh, you want to talk a little bit about how maybe that occurs and what's going on there?
Well, that's spot on, really. In cold weather, your blood's going to thicken up. The viscosity, like your oil in your car, depending on where you live, depends on what kind of oil you'll need at what time of year. So the colder it is, the thicker that oil is. Same thing with the body. So in cold weather, the blood is going to be a little bit thicker, which is going to be harder to push out. Your heart rate will go down, and this is going to be creating the high blood pressure, essentially. So in summer, that'll loosen up, and your blood pressure can drop. So you talk about high blood pressure and noticing it with cold weather. That's also a time when you'll see more heart attacks. And I have it somewhere. There's 200 additional heart attacks nationwide for each 1.8 degree Fahrenheit drop. So wow. There's a big increase in the wintertime in heart attacks, which leads to ambulance response time. If you look at the wintertime when it's cold, a 1% drop in temperature will increase the response time of an ambulance call, and that could be because of decrease in temperature, or it could be because there's so many more calls in the wintertime that create that. So
and that obviously could lead to more deaths.
Yes.
And then of course, you always hear a lot of people talk about shoveling snow and things like that, and a lot of times in the cooler weather you don't realize how much you're exerting yourself when you're out there and you're shoveling 6, 8, 12 inches of snow off your sidewalk, and I think that also kind of would probably lead to more heart attacks, correct?
Oh, absolutely. And in the cold weather, you're going to burn more fat also. Than it's a different. I don't want to get into the different types of fat, but fat gets burned more easily in the cold, and people think you're going to burn fat more in the hot weather, but that's not so. So your body is struggling in the cold versus in the hot because of the higher blood pressure, because of this added metabolism of the fat burning. So caloric burning will cause the stress on the body, which leads to these heart attacks because, where we come from, you're not shoveling so much snow, so I don't think about that too much. But yeah, when you're somewhere, I lived in North Chicago for a while, and they got snow 3 feet, and you're having to push that around. That is, if you try to push that much snow around, you feel that in your chest, and that you're going to get that pressure of the blood. The heart tries to start pumping faster, but because that blood is thicker, it just can't do the job, and it strains it.
Wow. So it's obviously it's a combination of a lot of things that increases heart attacks in the winter. Kind of another thing that really caught me by surprise when I started doing a little bit of research on this, and it makes sense when you look at it. and I had a couple of things on here that kind of went together, and we'll sort of combine the two maybe. But like mental health issues when it comes to the weather, maybe not so much the change in weather from day to day, almost as much as it is the change in like where you live. Sometimes causes a big difference. You know, you have more. I always heard you have a higher amounts of depression in like colder, cloudier climates, to where you don't so much in warmer, sunnier climates. And I know that's not really your field of expertise, Josh, but I know that you did a little bit of research to kind of touch on that. Can you explain maybe what goes on there? I think there's some sort of disorder or something that goes along with that, correct?
You may have to refresh my memory on the disorder, but I'll tell you what I know first.
I believe it's actually called SED.
SED.
So it's, oh boy, it's, I can't remember the acronym, but it's some kind of like solar deficiency. I don't know what it's
Serotonin
called.
deficiency.
I'm sorry?
Serotonin level deficiency is probably what it is of some sort. I'm not sure the acronym.
Yeah, you're right. I think it had some. Part of some things I was reading where it, where the sunshine and things like that help increase serotonin levels, and you have a decrease when you're in cloudier, cooler climates and things like that. And that's probably. I'll let Josh go because he's the expert here.
So, if like I've gone up to Alaska before, and in the summertime it's daylight, all but maybe 4 hours during the night. And in the wintertime it's the opposite. So you have it's going to be dark. So with that darkness comes a decrease in your serotonin levels, which is what gets you operating during the day. You're also going to have a decreased vitamin D level. So up there in Alaska, where they have 4 hours of sunlight in the wintertime, you'll see people who have to have UV lamps to get that vitamin D. They'll be put on antidepressants because of the effect of no sunlight. So in the wintertime, depending on what level of the hemisphere you are, you can definitely see effects of people leaning towards depression, suicidal issues, that they don't necessarily see the correlation to because the change isn't as drastic as it is in a place like that. But up there, they know about it. It's called seasonal affective disorder. I think Dr. over here just sent me a message. But yeah, that's definitely something. And like I said, if you're not in an area where it's apparent that these changes, just the slightest change can do it. So it's more well known in these areas in the high north that people live and go through it.
And I also I found one interesting thing, and to be honest with you, I did a little bit of research on this and found nothing. So if you don't know the reason behind it, I definitely can see why. But they say that suicides tend to spike in late spring, early summer, as the season changes from spring into the hot summer months. That kind of goes against the cloudy, cool, depression of serotonin. I don't know really what's behind it, and when I did a little bit of other people had no idea why that was either. Any theories? Any thoughts? Maybe.
If you don't mind repeating it, it cut out on me. I didn't hear what you said.
What I said was I tried to find some information on this, and I couldn't find anything. There was no real theory behind it, but they say that suicides tend to spike in the late spring and early summertime. Any thoughts, any theories behind that? I couldn't find anything that really where anybody knew why that was occurring. Because like I said, it goes against what we were talking about. When the cloudy, cool, more clouds, more darkness, the cooler temperatures usually brings on more depression, being stuck inside in the wintertime. So I don't know where the correlation comes in, but that's what studies show, that there's more of a spike in that time of year.
You're coming from the winter solstice, so you're gradually gaining more daylight, but it's still not as much as what you have in the summer. So they've hit that level of depression and that deficiency of serotonin or vitamin D, and they're in this disorder. And depression, whether it's seasonal or not, is a really hard thing to come out of. And so they're just on a downward spiral at that point, is what I would suspect. And
it's probably just finally catching up to them at that point.
The season could even be stressful enough on people to cause more issues. It's amazing. Depression's a heck of a thing. It really is. I have a psychology degree, and it's different with every case. You see different medications, and it's something that people really have to work through, and it's case by case basis. It's tough to pick out what may cause something. You can definitely see that there are going to be triggers, but it's really a lot of speculation, and what works for who is what works.
Right. And all right, kind of changing gears a little bit.
Hey,
Getting off. Oh, go ahead.
I was just going to say Ricky joined us. If you would
Oh.
welcome Ricky.
Ricky, thanks for joining us. We said Rick busy working on some homework for his diagnostics. Ricky, you want to jump in and say hello real quick? As soon as he figures out how to unmute himself. There he goes.
Oh, his microphone's not working.
And we still don't hear you.
There you go.
Nope.
Maybe not.
Jody,
He's just here to listen now.
I know he just posted that he did an update with his Windows. Could Ricky just chime in whenever you whenever you get it figured out over there? We'll continue on. Oh, go ahead, Scott.
I was going to also add, for those who are viewing tonight, we do have our question and answer section up and running. So if there is something that we haven't hinted on or talked about yet, make sure that you can shoot us a question, and we'll definitely ask our experts their opinion on that. So I just wanted to throw that out there. Back to you, Joey.
All right. And like I said, we're going to change gears a little bit here and kind of move into something that more people probably realize that weather and your health directly affect. Allergies, also asthma, that kind of thing. That's something that we all know. The springtime or hay fever and all the different allergies. Josh, we'll talk about maybe I don't know how the changing of the seasons really affect those symptoms.
Well, changes of the seasons, you're talking about, you could see in drastic temperature change. I know you guys will have one day here just last week, and then it was hot all weekend, was it not? Or was that the week before? But these drastic changes during the change of season can lead to like colds and such, is what the bleep is. That hasn't been proven though. But along with changes of season come different plants blooming, especially the trees here in the Carolinas, the pollen count. So all that is irritants that get into your system, and it just makes it harder for you to breathe. So you want to breathe in nice clean air, and it goes down into your lungs, and at your lungs and your heart there's this exchange between the two of the old CO2 and new oxygen, and anytime you're breathing in anything extra, it just makes it that much harder, and that's why people feel the pressure in their chest. Sinuses are going to clog up. I know that in mowing the grass, I always forget about how bad it's going to be, and I'll go out and mow, and I'll feel like crap for 2 days. And so then I get a mask, and I mow for a couple months, and then after that, But I grew up without allergies, moved away, came back, and I thought I was dying the first springtime. So they definitely can affect you, and it is just the fact that you have an irritant coming in. Let's see. The hot weather is also going to be able to affect those who have asthma a little bit easier, so it can exacerbate that condition. But what was I going to say? The cold weather, anytime you have more moisture, you can also see some difficulty breathing. So hot and humidity, you'll have difficulty. That O2 transfer also. So anytime there's anything extra in the air, you can see that.
I'm going to tell you, I hate living here in the fall and spring. My allergies suck, and everybody's like, I love spring and fall, and I was like, I hate it just because I'm in the freaking doctor's office with sinus infections like 4 or 5 times a year. So
yeah, I want to show you guys something, and we were just talking with consultants a few days ago. We always harp on severe weather, but what a meteorologist defines as severe is different than what your average viewer. Severity is it can just be anything that disrupts your day, and pollen just happens to be one of them. So we, like many stations, I don't know if you can see it here, but we have the pollen tracker, and my hand is shaking, so it's not really helping you guys. But that's our pollen tracker. And you'd be surprised that when we post it onto social media websites, how much outreach it gets, how much people really care about that, because it's a nuisance. Especially lately, we've had, at least in our neck of the woods, different kinds of pollens. I believe ragweed is the one that's really showing up, and it's a late summer, early fall kind of pollen, and that's been driving our pollen count up pretty high. And I've even been feeling it. My eyes are getting really itchy, and I'm having to clear my throat a lot. You know, stuff like that. Nose running, the typical allergy symptoms going on. But yeah, it's amazing how we'll be talking about the fact that we've got pretty strong cold front moving through. We could have strong storms, but we also do have to mention the pollen tracker in the morning. It's sometimes you don't want to mention that because you want to focus on the meteorology, but you know, as a station scientist, you're going to have to talk more than just weather. And that's part of where we come in with these kinds of pollen trackers or UV indexes. It's helpful.
Right. And I know a thing with I'm lucky. I avoid the allergies because I don't know. I just never really was affected too much about allergies. I know one thing, and I've heard, you know, we have Brad Panich on here a lot. I've heard him mention this numerous times about tree pollen, like the kind that you see that lays on your car and turns your car green in the springtime. That pollen really doesn't affect people as much because the particles are so large that it doesn't really get up into your nasal passages and things like that. So that's actually, when people see that, they think, oh, the pollen's really bad, but that actually doesn't affect people as much. Is that correct? I'm not really sure.
No, I've got a question about that. So if that is true, how much of it do you think is a bit of like a placebo effect, where people are seeing this, so they think that it's actually worse for you? That's if that is true, if what Brad is saying is right. So I want to hear from Josh about that.
When you're breathing it, when you see the you got me. No, the pollen, if you can see it, there's going to be other pollen there too that may be smaller. So he may be right about that. But just because you see pollen doesn't mean it's pollen that's too big to enter your nasal system. I mean, you could breathe in a lot of stuff. But basically what you're getting is an immune response, which is the histamine buildup, the running nose and eyes. It's trying to fight off what's coming in. It's not the pollen actually causing that. It's your body trying to flush it out. So basically what I would tell you, go get adjusted, and that might help.
way to plug one in there.
I'm at 2220 Springfield Road. There we go.
Another thing that we were talking about, because we were talking about asthma and allergies and breathing. I have sleep apnea, but I've learned really quickly that I sleep and breathe a lot better in cooler temperatures than I do in warmer temperatures. I don't know if that has something to do with the density of the air. Maybe cooler air is more dense. Any thoughts on that, Josh?
Thicker air with moisture is going to give you a harder time to breathe, which is what you're going to see in the summertime. Summertime, is that high pressure?
Well, summertime would be warmer, and the air would be able to hold more moisture at that point.
Is there a higher pressure that comes with that too?
Well,
It makes it a little.
It's gonna go back and forth. But yeah, technically, usually during the summer we're under a higher pressure situation more than we are under normally. I would say. I mean, you still have changes back and forth, but.
Yeah, so I would think that this thicker air makes it more difficult to breathe. The moisture in the air is going to make it more difficult to breathe. But it definitely is. It is easier for people to breathe when it is cooler. But you know, that's any extreme is going to be bad in the end. You know, you've been out when it's really cold and been jogging and you start to feel that pain. So there is such thing as too cold or too hot either way. But definitely summertime is known for a little bit harder breathing issues. Like I said, the asthma picks up. We definitely have more pollutants in the air in the summertime. But cold will kind of relieve some of that.
And that also goes back to the smog index. I'm sure, Chris, you guys probably have something that if you don't up there, I know we do. I say in the Charlotte market where there's a lot more cars and things where we have more of a smog buildup.
Right. Yeah. We're not really such a metropolitan area, say Charlotte or Raleigh, so we don't really have anything like a smog index. In fact, when you talk about AQI, there's not many days, but there's more days than up here where, say, Raleigh has an AQI of, it's code orange or whatever. Code orange around here is a big deal, to where it hasn't even happened since, I believe, late July of 2012, and that's when air temperature was in triple digits. So our case is a little bit different. Number one, because of our elevation. Number two, because we're not really a very metropolitan area. We've got the Tri-Cities, but none of them are really it's not really like a metropolis. So yeah, just a little bit of insight on that.
And I always love going to the mountains because I always feel like the air's cleaner up there anyway. Speaking of pressure and things, Josh, another thing that I want to touch on a little bit maybe and is headaches. I know you have a lot of people who say, bright, sunshiny days, which would be a high-pressure situation, they get them more headaches at that time. Also, I would also think, just coming from experience with migraines and things, bright, sunshine, and longer sunny days will cause a little bit more in the migraine department because that bright light it's harder to get your room completely dark to get rid of that migraine in the summertime as it would be at nighttime in the winter. But let's talk about maybe, the more direct, pressure, and its effect on headaches and things like that.
Well, when it comes to headaches, especially migraines, you don't have blood that's in the brain. It's cerebral spinal fluid. We just call it CSF. So there's actually a blood-brain barrier, and that CSF is in your brain and all the way down through. Any change in pressure is going to adjust the pressure in the brain because of that. I mean, it's a fluid. So with migraines, they're going to be, if a person is prone to migraines, light sensitivity is a gimme with migraines, and it could be a trigger too, I would suppose. Migraines are most often going to be on one side of the head, but definitely a change in pressure is going to be able to affect the CSF. Now, I'm not sure if a higher pressure or a lower pressure would affect that. The brain doesn't have a lot of there's a lot of nerve connections, but there's not necessarily a lot of pain sensors in your brain. So the pressure you're feeling, I'm not sure how it gets to you on that.
Yeah, one thing that
have a change to go along with the pressure in the air.
One thing I've noticed, because my older brother, he gets migraines, and when he gets them, it's like you want to take him to the emergency room because you just think he gets it. It actually gets frightening when he gets migraines. He'll start off where he starts losing vision in one of his eyes, and that's when he knows he's starting. But to my recollection, it seems like every time he gets one, it's a bright sunny day, or a big change has just happened. The last major one I think he got was when Hurricane Irene went up the coast. And I believe it was right before that, because I was watching coverage of the hurricane, and he was upstairs having a heck of a time, just pretty much fighting to, not get sick. I don't want to get too vulgar here, but it seems to me like the drastic changes in pressure within a short amount of time are really what gets him. Like I said, it's just weird. He starts losing vision. He starts. He'll start to go numb in his hands, which it seems like would be right up your field, Josh. I don't know.
Yeah, on him if he's starting to feel that comes from nerve irritation, and that could definitely be because you're saying a quick pressure change in the environment. like I said, because you have that CSF is not just in the brain; it's going down the cord. Your cord is part of your brain. It's all connected. So you have this tube that goes down, and the CSF's there. So if it's having pressure here, it's going to be down here, which this is where your nerve is out. And if he's got tingling in his hands, that's right, kind of mid to lower cervicals. The pressure can build up right. I mean, the migraines, you can get a lot of different symptoms for them, and that's. Have you heard of paresthesia with the migraines? Yeah, it may not be directly a migraine. It may be a different type of headache.
Yeah.
That's just speculation that it could be that, but just here recently I looked at research that said that over half of doctors are not prepared to deal with people coming in with headaches. They're scared to death of them. It's tough thing with.
Yeah, because another thing that will happen with him is he'll, like I said, it's the vision, the hands going a little bit numb or tingly is what he'll say, and in extreme cases he'll start slurring his speech. He starts to kind of lose control over.
Really?
And there have been times when he's been. We were teenagers, or he was in his early teens, and my parents were taking care of him, and he was in a dark room, no TV, no nothing, and he started yelling at them to turn the computer off. Like he was just going completely oblivious to what was going on. He just lost it, and thank goodness it hasn't happened like that recently. But right away for me, I start thinking, okay, the weather's got to be affecting him. And the last case really seems to be that, like we were saying, the drastic pressure change.
Yeah, he's got a lot going on. If you want to get some information to Joey or any of them to send my way, I might can send you some referrals or some ideas if he ever has any more issues or wants to check it out further. I don't know. It's one of those things you got to find what works for you, but he's definitely sounds like he's got a special situation going on.
Yeah, no, and like I said, luckily it hasn't happened in a long time. So, but I don't want to distract too much from the conversation at hand here. But yeah, we'll have to talk about that.
Yeah, the slurring of the speech, that's where it gets kind of scary.
Yeah.
You have pressure in the joints. You have the facets, or it's where your vertebrae come together and they kind of rock and extend, so you can get pressure back there. If he carries any tension in his neck, everybody carries tension in their neck or shoulders. That can cause the tingling in the hands, and with a headache, all that gets worse too, or that being so tight could cause the headache. But definitely, it's interesting that you say you've noticed a quick change in pressure, a hurricane coming through, and that hits. I'm gonna keep an eye on that. Basically, when I see people coming in, I'm gonna start looking for weather conditions to go along with it, because that's pretty interesting.
Yeah, absolutely.
Yeah, my theory there would be your brain probably, or your entire body, it probably has some amount of self-adjustment to where, when the pressure changes, it adjusts itself, and then when you have a quick change of pressure, your body probably can't adjust itself quick enough. And I would think that might be the kind of trigger of some of those headaches and things like that.
Yeah, some people who are going to be more prone may not have the ability to adapt as quickly or as easily as others, and that's a lot of what we do with chiropractic. Is we're adjusting your spine in order to allow your body to adapt faster, and it's 100% of its function, which anatomically speaking, everyone can be different. So you could see somebody go to a chiropractor for care on something like that, and they could see a great result and say, oh, it was just my bone was off pushing on this nerve, and anytime there was an increase in pressure, that nerve couldn't send out the signal that it needed to in its best way. Or you could have somebody that it's not related to that. It could be related to a completely different issue.
One last thing before we jump to our next subject. I used to have headaches a lot. Again, I said I had sleep apnea. I got my machine where I slept better at night. Those headaches went away. But one thing that helped me the most, oddly enough, was peppermint. I could light a peppermint candle or something to that effect, and you'd be amazed. The peppermint would ease the headache. It wouldn't always get rid of it. Didn't work every time, but a lot of times it definitely help. I tell people that all the time. I say when migraines, it seems like you have to, your eyes, your smell, your sound, it affects all of that. And so what I did was get rid of all the light, make everything quiet, make the room cool for your touch sensation, and then smell and taste. Put in peppermint. Amazingly, it would help a lot. But we're got about 20 minutes left of the show, so I want to get to. I got one question that I'm going to ask. We'll do that one, and then we're going to jump into the one topic that I'm sure a lot of people tuned in for. The main thing about joint pain with the changing in weather. But before I get to that, I had one viewer question. She asked about. I sent this to Josh. The question ahead of time was it pelvic floor dysfunction? Is that what the name of it was?
Yeah, that's what you sent me. Yeah.
Yeah, pelvic floor dysfunction, and she said that when it rains, her pain is less. When she vacationed in Utah up in the mountains in the ski resorts of Park City, her pain was less. So it's obviously to me that in a lower pressure situation, her pain is less. Did you find anything out about that, Josh? Maybe any ideas on what's causing that, or things she can do maybe to help with any of that?
Well, I'll tell you. I asked half a dozen doctors. They've been practicing for 20, 30 years plus, and they all looked at me and kind of smiled and said, "Better you than me." And so, but there is something there to it. It's we all think about joints, and I don't know if we kind of touched base on it, and everybody kind of assumes cold weather, your joints are sore, or it's going to rain and your joints hurt, and that's the change in pressure you have in between each joint is fluid. We call it synovial fluid. So there's little capsules that the joints sit on, and so you'll feel that because of the lower pressure. It starts to expand, and if you have any issue there, you're definitely going to notice it, and you're going to have more pain. With pelvic floor dysfunction, it's a different beast because it's not a joint now; it's now muscle. So what's happening is that lower pressure is allowing for this muscle to relax before it was being compressed, which could cause it a little more inflammation and irritation, as opposed to, like I said, that lower pressure giving her relief. It's like if you have a muscle that's really tight and you can go in and massage it and push on it, and now it's able to release out a little bit further instead of grasping down. And that's basically what that lower pressure is going to do. My first thing was, as soon as you said that, I said, well, she's had a few kids, right?
Yeah, and you are correct, yes.
And that kind of goes along with it. And there's a few things that she can do. Off the top of my head, there was something I heard here recently, and I'll try to get it to you. I meant to try to search that down before tonight. We're on the end of our quarter, so it's been a little busy here. But I'll look it up and see what it was most recently I heard helps. But yeah, it's a muscle issue, so muscles kind of work the opposite of how the joint pain works.
All right, and you said that I'm not going to give her the advice to massage her pelvic floor area, especially in public. But anyway, so a quick question, just trying to make things click here. Would something like water exercise, like water aerobics, I mean, would that make, I mean, when you're in the water, would that not cause less pressure on some of those muscles, maybe?
That's possible, yeah, because there are a lot of therapies that get done in the pool. But yeah, that and Kegels or Kegels, depends on where you're at, how you pronounce it. I found out something like that could help increase the integrity, but
or just move to that ski resort.
Yeah, I mean, you're on vacation and you feel better. What better reason than to relocate than that?
All right, and kind of piggybacking on that into what you kind of already spoke about, let's discuss the joint pain, because that's a big one. That's the one that everybody always says. My knee hurts, so I know it's going to rain. Usually it comes from a pre-existing injury, and then then from then on, they say every time it rains, my knee hurts or something like that. Let's talk about what causes that.
Well, like I just said, we're for one, it was this synovial fluid is able to expand, and if you have any issue there, now it's pushing out and causing more pain. During those cold fronts, we said lower pressure. Go back to the first thing we talked about was the viscosity of your blood, or how thick your blood is at that point. So there's that. With that thickness, your blood is also going to move more central during the cold weather, and so there's less blood out here, but what blood is there is thicker. So now you get kind of this all-around sluggish feeling, and so everybody I've talked to who's been practicing for a long time, they definitely see it in their patients. They'll come in and they'll just feel a little bit stiffer and sluggish, and there's so many different levels that we could speculate on. That it's the seasonal affective disorder, the serotonin, the vitamin D, the thick blood, the expansion of synovial fluid. There's so many different things that can cause it, and it's not that it would necessarily be one thing for one person. It could be a different combination. Like I said, everybody's body is a little bit different on how it operates. So, and even your blood viscosity can do with your hydration level and your diet. So there's a lot of things that can be taken into account. But like I said, thickness of the blood, the expansion of the joint space, and the blood actually trying to move central are going to be all that sluggish soreness that comes along with cold weather.
Yeah, I think it's interesting from a weather perspective hearing about the fluid expansion. I've been taking notes here the whole 45 minutes that we've been on, and when you're talking about the fluid expansion, we start talking about low pressure systems. And generally, with that, you have rising air, and as the air rises, it cools and it expands. I start thinking in that kind of fashion, in that when you have low pressure, you have air generally expanding. When you have high pressure, you generally have air descending, warming, and compressing. So that just clicked with me, and so I'm sitting here. This has to be one of the most interesting discussions I've had with anyone outside of weather, yet still talking about weather and its effects on people. And I'm just kind of blown away by something that seems so common. And we're talking about joint pain. I get people calling all the time. Well, I got to go to therapy, but my joints hurt like crap because it's cold outside or whatever. So no, I just had to add that little tidbit in, and seeing how dynamics in the atmosphere are actually kind of attributable to what's going on in the body. That's really just interesting.
And I'm a person most everybody here knows that I have arthritis, so it affects me a lot. So I definitely know that when it gets cooler in the wintertime, I'm a lot stiffer. It takes me a lot longer to get going. When the warmer, when it's warmer and I've noticed sunshine, and that probably has a lot to do with the vitamin D intake and things like that. But getting a lot of sunshine always helps. Josh, are there any other ideas that you can come up with that people who do suffer from, say arthritis or joint pain when it rains and things like that, anything they can do to help relieve some of that? I know obviously coming to see you as a chiropractor is one, but is there any other ideas, things they can do at home maybe that would help them relieve a little bit of that pressure?
It depends on the situation. You think like someone has a sprained ankle. RICE is a common acronym. You want to rest it, you want to ice it, and you want to compress it. So that compression makes it feel better. So that's we're talking low pressure coming in. That's basically relieving that compression, which is when the pain comes in. And you also have to keep that compression to it. Now all these things that you're doing are killing the immune response, which is going to heal it, but it also reduces the pain. The ice is there to reduce the inflammation, which comes along with the blood flow too. But as far as at home, it's case by case. Movement is the most important thing. We say here motion is lotion. So if you can move a joint, it may be stiff, but if you can keep moving it, it'll work it and free it up. That being said, if it's really bad, this is not medical advice. This is just anecdotal. So, there's some people, there's some joints. I split this knuckle in half, and I've had surgery on it, and I forget about it. And then in the wintertime, that bone starts hurting. But in the summertime, it goes away. But I have to move that. Now, when I split that knuckle in half, it was not a good idea for me to move it. And I did anyway. I don't think I caused it to crack all the way in half. So there's times where you don't want to move it, but once you know that the joint is healthy and it's just a matter of ab stiffness and soreness, most of these loosen it up. But the big thing is it degenerative or is it inflammatory?
All right. Well, we're kind of getting closer to the end. Does anybody have any other questions they want to throw at John or Chris here?
What about sunburns? How do you take care of sunburns?
Oh, that's a good one. Josh, you have any advice on a sunburn? What's the best thing to do other than not get one?
Cool water is a good idea. I do aloe with lidocaine. The aloe vera gel is what I found works best. But if you just put it on one day and you let it dry up, you'll be peeling pretty soon enough. You want to stay on top of that, so you want to keep it kind of moist. And along with keeping it moist, you want to stay hydrated. So drink plenty of water, and check the type of sunscreen you're using. A lot of people don't use sunscreen strong enough.
I've always heard, as Joey and Ricky know, I go down to Florida for about 10 days every year, and I actually ran into a guy who was one of the workers that work for the company that makes Motrin, and they actually said that if you take Motrin, then out of your sunburn, it's like 50% more relief, that it doesn't burn and itch as long as it would if you didn't take it. So I've always taken Motrin, and especially Motrin PM at night, so you don't have to feel crappy all night long, so it'll knock you out. But yeah, I take Motrin as well, so I don't know if there's any truth to what they told me, or that's all psychological, or what?
No, there'd be truth to that, because Motrin is going to be an anti-inflammatory, so it is going to help it feel a little bit better, and in feeling better, whether it heals faster or not, I mean, that's what you want, is to feel better. So basically, that's not bad advice at all. Just what you want to do is, like I said, stay hydrated. The Motrin's a good tip. Keep an aloe on it constantly, and don't ice it. Icing it is going to cause it to go the opposite direction too fast and cause more damage than good. So, but the Motrin's a good tip, real good tip.
Yeah, I mean, it made me feel better the next day. I didn't know if it was like just up here or what, but it's awesome to know. I guess the only other question maybe I had, and like I said, I don't know if you know the answer to this, but we see all these different types of allergy commercials and medicines and stuff like that. Is there a certain type of allergy medicine that I know fall's getting ready to roll around, and I guarantee you 60-70% of the population is going to be suffering from that? Is there any stuff you should buy, you shouldn't buy, or do you have any advice on that?
Yeah, that's just something that every individual's got to consult their own medical professional. I try to stay away from allergy medication myself, but in saying that, I do hit it up early on in the season when it's the worst. But from my area of expertise, we're going to try to work on making your immune system as optimal as it can be, and in turn that should help you fight off the allergies. There's a lot of guys out there that do work with allergy specific that aren't just medical doctors, that are doing acupuncture. There's a guy here locally who does something I'm not too sure about. I saw him a couple years ago when I first started, and he's seen some great results there. So it's just one of those things you got to go out and try and see what works for you. But as far as like which medicine to take, I couldn't even begin to speculate on that. That's something that they'd have to consult the guys who actually prescribe medicine. We don't do any of that, unfortunately. Or fortunately, however you look at it.
Yeah, sometimes that might not be the honest thing to do. Joey lost internet service, so I guess I'll kind of take over here. Ricky, I know you've been doing a little bit of stuff here and there. Do you have any questions or anything?
Is my microphone working now?
Yeah, we can hear you.
That's a miracle. No, I've really just been listening in. It's a lot of interesting conversation. To be honest, I've been in and out because of dynamics, but I really appreciate you coming on here because I need to go back personally and watch this episode just to see some of the things that were mentioned. So.
Yeah, most definitely. And I know Joey's a friend of yours, so any of our viewers who are watching tonight, if you think of something in the next couple of days or whatever, we can definitely shoot a message down and hopefully get it answered with Joshua down in Spartanburg, South Carolina.
I'd like to point out one thing before we end. Is that okay?
Yeah, definitely. Go ahead.
This is just research I came across. It may be of importance to some people, but I thought it to be interesting. It's from a few years ago, but there was a research done trying to speculate whether prostate cancer was more prominent in Northerners or not. And what they found was that they said 1 in 6 men develop prostate cancer in their lifetime across the Northern Hemisphere, and that this is going to be a higher incidence than in the South, and that this can be weather related. It's not 100%, it's just speculation, I think. But that there's persistent organic pollutants that cause the cancer, and that the researchers believe that the cold weather prevents these pollutants from being able to metabolize or degrade as fast as they would normally. So they also they also head towards the ground. You meteorologists will have to say. But I thought that was a pretty interesting thing because of the cold air. You have these pollutants which can cause cancer, and because of the environment, they stick around longer, which leads people to be more prone to this prostate cancer. And they also said because of the vitamin D deficiency and lack of exposure to UV radiation, that could also be a meteorological condition that makes them prone to it.
That's interesting.
This is just by listening to that. This is purely speculation. In the summertime, I feel like, and again, this may just be purely speculation. In the summertime, I feel like the likelihood of you having a more unstable air mass goes up, and at that point is when you would start to see these pollutants not sticking around. In the winter time, when you have cooler air, I think it would be more likely that you have a stable air mass, and so things do stick around. So as far as the relation between colder air pollutants, that may be one of those things that keeps them in the lower levels of the atmosphere and maybe keeps them around, starting to allude to a higher likelihood of prostate cancer. So that's just one thing I'm thinking about from a dynamics perspective, which Ricky is probably like, please, Chris, don't talk any more dynamics right now. But well, when you think about that, that's kind of interesting, and to see how atmospheric behavior may actually drive those pollutants to stick around a little bit. That's an interesting point.
And along with that, I think I might have touched base a little bit. Prostate cancer presents as low back pain, and there's a lot of articles. A lot of people think that low back pain comes around because of colder temperatures, and that's found to not be true. So if cold weather comes around and you're starting to feel low back pain, they're not necessarily related as a musculoskeletal issue, and it may be something you should definitely be checking on. But just about